is when two or more vertebrae have lost their normal motion and or position. This can cause interruption to the normal nerve flow and interfere with the communication from the brain to the body and from the body back to the brain. Research at the University of Colorado found that it only took between 8 to 10 millimeters of mercury pressure to reduce the nerve supply by up to 60%. That's about the weight of a small coin. Compression can exist without pain, so that means where the nerve goes to can be robbed of up to 60% of its nerve supply, and you may not even feel it. This is what is referred to as a silent subluxation. Even slight pressure on the nerves can alter the quality or quantity of the messages being sent.
It can slow it down.
It can speed it up.
Or it can distort the nerve messages to and from the brain. At the tissue and cellular level, the interrupted flow is sometimes inadequate to the demands of the body. As you've just experienced, when there's a communication breakdown, it's really hard to understand the message. So what happens when you have a subluxation? That area can start to degenerate in as little as 2 weeks. This degeneration causes scar tissue to develop, which leads to more scar tissue. This degenerative process can continue as long as the immobilization is present, and this type of degeneration is preventable. Spinal degeneration has nothing to do with how old you are. You can be 60 years old and have a perfectly healthy spine, or you can be 10 and have a spine that's already showing signs of degeneration. It all depends on how and when the subluxation occurred. In fact, a 2003 British study using MRI showed that 9% of 10-year-olds already showed signs of asymptomatic disc changes. Previous to this study, it was thought that disc degeneration could only occur after puberty. Now let me guess, you're wondering how these subluxations can affect your health. So let's find out. Subluxations can interfere with normal communication between the brain and the body. So for example, the nerve supply from your neck goes to the immune system, pituitary glands, sinuses, face, middle and inner ear, eyes, tonsils, teeth, neck and shoulder muscles. The nerves from your thoracic spine go to your arms, hands and fingers, heart, lungs, gallbladder, liver, stomach, pancreas, spleen, kidneys, small intestine and lymph glands. From your lower back, large intestine, appendix, abdomen, sex organs, uterus, bladder, knees, prostate, lower back and leg muscles, and that's just naming a few. Okay, so now you know where they go. What does that mean? Well, that's a good question. If the nerve supply to anywhere in the body is disturbed, it can eventually lead to a symptom. Symptoms are the only way for your body to let you know that something's wrong. So let's go back to the same spine again. If you have nerve interference in the cervical spine, it can lead to headaches, migraines, lowered immune system, sinus troubles, hay fever, abnormal sleep patterns, eczema, hearing loss, tonsillitis, chronic cough, croup, pins and needles into the arms and hands. In the thoracic spine, asthma, functional heart problems, bronchitis, influenza, gallbladder troubles, liver conditions, blood pressure problems, indigestion, heartburn, gastritis, lowered immunity, allergies, kidney troubles, chronic tiredness. In the lower back, constipation, menstrual problems, bedwetting, knee problems, sciatica, backache, poor circulation, swollen ankles, weakness into legs and cramping. Wow, I'm out of breath, and that's naming only a few. Did you know that less than 10% of your nervous system perceives pain? So quite often, by the time pain and symptoms appear, the nerve interference could have been present for months or even years. Think about when a person has a heart attack or a stroke. They don't actually feel the arteries blocking up and usually don't know anything's wrong until it's too late. Painkillers and anti-inflammatories can cover up the symptoms, but they don't get to the cause of the problem. By masking these symptoms, it allows the problem to continue to develop silently until there's a major health crisis. We all know about the damaging side effects that can occur from long-term drug use. So why continue filling your body with drugs to hide the cause of the problem? Think about all the talk about cleaning up our world's environment. Remember, our body is an environment too. The best way to fix the problem is to restore proper communication. Now you might be wondering what causes subluxations to occur. Gardening, sports, computer work, pregnancy, improper lifting, arguments, food additives, chemicals, birth, poor posture, to name but a few. There can also be mental causes, such as stress. The average 5-year-old has had approximately 2,000 falls, of which 200 are considered serious. But usually an isolated event alone is not to blame. It's an accumulation of many of life's little incidents and accidents. Recent research has found that in births that required intervention by a doctor, which means they used forceps, suction or excessive force, 95% had upper neck injuries. So it's a smart decision to have your child assessed at an early age. To become a chiropractor, it requires 5 years of full-time university study. So the average doctor of chiropractic has attended 4,485 hours of university education. On the other hand, the average medical doctor has attended approximately 4,250 hours of education, depending on specialty. A chiropractor is the only university-trained spinal and nervous system specialist, specifically trained to locate and correct vertebral subluxations. So the chiropractor's job is to locate and correct spinal interference so your nervous system can perform at its own optimal level. Remember, the immobilized area will degenerate at a faster rate than the area with good balance and movement. Fortunately, with the right care and by mobilizing these areas and creating good alignment, the body can begin to slow, stabilize, or reverse the degenerative process. Chiropractors assist the healing process by re-establishing the nerve flow to its optimum level. This allows the proper communication between the brain and the body. Chiropractors don't treat the symptoms. Rather, they remove the nerve interference, which allows the body to do what it does best, heal itself. When you get a cut or a broken bone, who heals it? Your body does. Research shows that families involved in regular chiropractic care experience less pain, get sick less often, miss less school and work, and function at a higher level of health. In other words, they have a better quality of life. A study by a US insurance company showed that clients who used chiropractic used far fewer medical services. On average, hospital admissions were down by 60%, hospital days by 69%, outpatient procedures down by 85%, and pharmaceutical costs by 56%. That's huge. The Journal of Pediatrics found that chiropractic is the most used alternative healthcare for children. Millions of families choose chiropractic care not only for fast relief, but to achieve peak performance and a lifetime of wellness. In 1979, the New Zealand Commission of Inquiry into Chiropractic released their report. After 18 months of research, they concluded that spinal manipulation in the hands of a registered chiropractor is, quote, remarkably safe. They also commented that chiropractors are the only health practitioners who are equipped by their education and training to carry out spinal manual therapy. These days, you should have a healthcare team made up of a chiropractor, dentist, optometrist, an exercise and nutritional coach, and a medical doctor. We all know that nutrition, exercise, and a healthy state of mind are essential for your total health and well-being. You can go for days without food and water, minutes without air, but without a nerve supply, life cannot exist. Nothing happens in your body without the involvement of the whole nervous system. So we hope you now have a greater understanding of the truth behind chiropractic healthcare and the impact of subluxations on a fully functioning nervous system. The most current research is now telling us that we will be living to 100 and beyond, whether you want to or not. How your health will be when you get there is your choice. Only 30% of your health is genetics. The rest is up to you. How much is your health worth? Ask anyone who is experiencing or has experienced health problems in the past, and they'll tell you, your health is priceless. All forms of the healing arts have their place, and let's face it, medicine has an important role to play in crisis and emergency care, and in these situations can be life-saving. On the other hand, chiropractic is vital in keeping your body functioning at its best possible level by removing nerve interference and allowing the body to heal itself. So for health, wellness, and quality of life, chiropractic is the smart choice for you and your family.